So this is our last presentation for this session, and we have Janeen Lallard, who's Health Provider Clinical Liaison from the Central Adelaide and Hills Medicare Local, and Janeen is going to be joined by Cathy Zesers, who's Health Provider Support Manager at the ML. So welcome to Cathy and Janeen. Thank you.
Thank you, everyone, and thank you to Janeen for doing such a lot of work to bring this together, and I feel a little bit of a fraud standing here, but I'm very humbled by being amongst some great people in the room and to be part of those presentations as well. It's been fascinating, and I think ours will tie in very nicely, a little bit different, but I also wanted to say thanks to APNA for not only being members of the Medicare Local, that we are also members of theirs. It's a nice partnership, but to give us this opportunity and to give so many people an opportunity to present here and share what they're doing. And what we're going to share with you this morning is around a model that a bit more than 12 months ago we embarked upon with primary healthcare nurses across our region. Prior to then, we started from the ground up as a Medicare Local. Essentially didn't move from a division, but we gathered some expertise and some good skills from across the area. Janeen and I both have quite a bit of experience in different areas of nursing, and more recently in leadership roles. So we're able to take a fresh look at how can we go forward into the next bit. We were hoping it would be for quite a long time, and our presentation's called Leading the Charge, which was only one letter different to change, but essentially that will lead us into the next bit, and we feel confident, and we have to all be optimistic because there's a lot for us to charge forward with. I was disappointed I missed seeing Rosemary Bryant yesterday. She was my first nurse leader. She was the Director of Nursing at the Royal Adelaide Hospital when I did my training almost 30 years ago. So, we're surrounded by a lot of great leaders. We thought we'd tell a bit of a story, but rather than us tell it, we thought we'd get the nurses who we've been working with in recent times to tell that story. So we had a bit of fun. Mostly Janeen, going around and doing some filming. She has a new career thing to have on her CV. But essentially we asked a number of questions, and our focus was around a mentorship program that we have had going through the last year or so. And we looked at topics around innovation, leadership and diversity. And we asked a range of questions. And at the moment, I'm not going to say any more, but I'm going to let it speak for itself. Okay, just to give you a bit of context, the Central Adelaide and Hills Medicare Local is that little red dot down in the bottom there, and over to the side. It's actually not a big geography, but it's a lot of people, so it's a bit more than 500,000 people in that patch. There is about 220 general practices in that area, but a lot of diversity, and when we sort of started talking about diversity in primary healthcare nurse roles, we also talked about the diversity of our population, and sometimes that drives the directions that those nurses were moving into. So as I said, about 1/3 of the SA population resides in that area. About 215 general practice nurses, and that's not that many considering those 220 general practices. We have a lot of solos, we have a lot of Vietnamese and other cultural background GPs. So, and a lot of them are operating sort of in models that we're working with around supporting them in the best possible ways. We have about 12 nurses working at the Medicare Local on a range of projects, from COPD, care coordination to chronic disease, closing the gap, and some mental health. Our health priorities for that region are around Aboriginal health, mental health, COPD, palliative care and aged and community. And here comes the expert, which is good. And our work with, I manage a health provider support team, and Janeen is that person who works with the primary healthcare nurses. We also have other roles like an OT working with aged and community. We have a couple of GPs. We have some practice management support. So our focus in the first instance, because in that population seemed so large, we focused on what were our priorities based on our local needs and our health planning. So when we looked at what are we going to do with primary healthcare nursing, and we had that opportunity to take a little step back at the beginning of last year, we thought about what would we like to do, and obviously speaking to nurses was the most critical point to start. We welcomed that opportunity to look at doing some things differently, and we spread the word, and we asked quite a few questions, and we got people together, and we sent out questionnaires and invited expressions of interest to be part of a panel. And they came from schools, from general practice, from the local health network, whom we work very closely with, aged care and child and family health. They were looking for a network as well, for updates, for leadership opportunities, to supervise students and to continue their learning. Should be okay now. Right, I'll just that one back one more.
Primary healthcare nursing is growing. In South Australia, numbers of nurses working in general practice rose from 253 nurses in 2004 to 1,200 in 2011. Along with this workforce growth, opportunities for diversity, leadership and innovation have optimised the value of the role.
This is the area for growth. It hasn't happened enough. It's happening in patches around the place. 2001 was really the very first, splurge of pushing for more nurses to work in general practice. We've come a long way, but we've got a long way to go.
Primary healthcare nurses today are working in a diversity of roles, utilising a range of skills and across a wide community, from schools to aged care to community and in general practice.
The general practice role of a nurse is so diverse that we are involved in so many aspects of the care of a patient.
I think the change that has come in primary healthcare nursing has been well needed. It's so varied and diverse, and I think it offers such great opportunities for people and great challenge. It's a great lifestyle as well.
Nurses in our community are providing leadership and mentorship. They're educating and innovating across the ever-changing environment.
We're a small practice, but we have 4 nurses, and we encourage all of them to share leadership in their roles.
I'm a leader in setting up systems within the practice that we're working. I'm also a leader with patients in providing education, helping guide them into the right supports.
I see a distinction between nurses and nursing. So it's any group, that any nurse in any nursing role that is having an influence and can have an impact on changing the outcomes for people through primary health care.
The networks, the focus on quality, being engaged in system change both at a local level and at a professional level are all hallmarks of a progressing role.
I joined the mentor group as I really wanted to gain confidence in my leadership skills and also network with a variety of nurses across many different sectors.
Networks are just essential, I think. People can't do things in isolation. It's very, very hard to do, to bring about significant change.
I get to network with other nurses and other people working in primary health care.
It's been increasingly evident that primary healthcare nurses in a range of settings are contributing to the ultimate goal of primary healthcare, a passion for improving health outcomes.
A highlight for me as a nurse is the rapport we have with patients, and I really enjoy dealing with their everyday needs and their chronic disease management, and they enjoy coming to see us and sharing that with us as well.
Particularly in primary health care, we tend to work as a team, and it offers so much more diversity and experience, and you get to build that relationship with patients and their families and help them have their best life that they possibly can.
They can't just keep silent and invisible. They have to be out there. They have to take this leadership role. They have to see the value in what they do themselves and promote that value. Be passionate about it. I'm passionate.
The role of the primary healthcare nurse is not only increasing in number, but also in their sphere of influence and innovation for improved outcomes across communities. A vital primary care resource, primary healthcare nurses are ever evolving and leading the way through change.
In 10 years' time, I really hope for great autonomy out in the community. I really hope that there's a lot more of taking the care directly to the clients and that nurses can truly lead the care and organise care for clients out in the community that really need it.
The nurse's role is very valued, I suppose, because we are the centre and often the link in that team between the patients, the admin, the community, the doctors.
The diversity is there. The leadership is what you're encouraging. You have to encourage that at the individual level as well. The value of nursing cannot be underscored. It's just, you know, we're never going to go away. And we're only going to have more opportunities with more leaders coming through.
Thank you. Hope you enjoyed that. We've had a lot of fun, and Associate Professor Kay Price is the wonderful person who, sorry, I'm going too far now, who led the mentor training, leadership training with the nurses. Okay, so where was I? Next one. So, what's that? Okay, so around identifying relationships or working with collaborators across our area, there were many, and we've got lots of great relationships with organisations, like I said, with the local health network, with the Royal District Nursing Society, and there are some pictures there from our recent International Nurses Day celebration. We've been liaising with them about some local opportunities with Child and Family Health. We've also been talking to Adelaide to Outback, who are GP nurse GP training organisation, and they've been running a student project where they've been placing nurses in those practices, and that's been great to be a part of, and we've shared some education opportunities along the way as well. Also our friends in the university sector, and Jeff Fuller is down the back there. He's in one of those photos there. We actually had a group come to visit us who were visiting from China and Turkey, doing some work with Flinders University. They were around nursing or primary healthcare nursing research, and they were doing some training while they were here. So great opportunities to talk and look at a program from the ground up in our area. And I'm actually going to hand on to Janeen now, who's going to tell you a little bit more about the panel.
So firstly, I wanted to say that, you know, the leadership theme, Robin, I think it was, I agree with you. It's been very empowering over the last few days listening to these themes come through. Something that Stuart Constable had said on the first day about leadership comes from anywhere and must come from anywhere. And we're seeing a lot of those themes today, and you talked about the levels of leadership and can really resonate with that with our group. I loved listening to Dr. Rosemary Bryant and Karen Cook and Dr. Madreen on being visible, the nurses being visible, which was a lot about, this presentation is about those nurses and what they're giving to us really. So the panel, Cathy's touched on it, but yes, we've got this concept of a primary healthcare nurse mentor panel. It's a group of nurses from a different variety of primary healthcare settings from across our region, and they're nurses that are really seeking opportunity. They're very experienced and they bring a really extensive and diverse set of skills to the group. So, you know, right people bringing the right set of skills really. The how of the panel was an expression of interest really, but there was, you know, some criteria. We did want sorry, I got distracted then. We did really want a diverse group of nurses, and that's what we did. We're really pleased with our our group. They're a wonderful group of nurses. This allowed us to gather really their experience and their skills and really get a sense of what the group might bring. And why did we form the panel? We wanted to hear from those at the front line. We wanted to hear what's happening at the front line, what are the gaps, what are the needs, what do they need from the Medicare local, and to build our capacity too. You know, in the Medicare local we might have a position of support, but I need others to help me. I need to gather the troops and we can get to more nurses working out in primary health care. Who's on our panel? So we've got a variety. We've got practice nurses, obviously. We've got practice nurse manager roles, which you saw some in the video footage. We've got a nurse that's working in state health, in the state health policy for the chief nurse. So that she has a very extensive primary healthcare nurse background, so she brings lots of information to the group. We have a nurse practitioner candidate, although I will say she is now certified as a nurse practitioner, working in general practice. We have Kay Price, you've met, Dr Kay Price, the Associate Professor, and we have a practice nurse that's also working for the Adelaide Outback, so is a liaison for students in general practice. So I've just got another slide there demonstrating the expertise that this group does bring. So I won't read through all of that, you can read that. We really wanted this panel to be participating from the beginning, so probably should have that the other way around too, purpose and then objectives, but we involved this group in their terms of reference. What did they want out of this group? And it was a two-way support. Can they support us? Because we do need them. And can we support them? So they were just really putting that up there to show you that we did involve them from the start and that we provided a structure and a purpose for the group. The panel progress so far. So there's most of our panel members standing there, and that was at the end of our leadership and mentor training that we held. I did notice that health workforce diagram come up earlier this morning too. So getting involved, the members were able to contribute to a project submission that we put forward, and they were really interactive in that procedure, in that process, and really enjoyed it, I think. Taking opportunities, they really were keen when we suggested the idea about leadership and mentor training and helping them build that confidence. So we structured that training around when they had availability, when their time, as we talked about before, time is really precious. When could they come? So we structured that training of an evening for short periods of time that would really fit in with their busy lives, and they did. They came and they attended the sessions. Links with university we feel are really important. I've got Flinders University, I've already mentioned Jeff being in the room, and the other universities in Adelaide as well, with Kay, who's from the University of South Australia. One really important thing that came out of this leadership and mentor training was that these nurses needed to have a mentor themselves, and this has just been brought up in the previous couple of presentations. Kay really worked with this group around, have you thought of a mentor? Have you thought of someone that you can look up to? Doesn't have to be in nursing, doesn't have to be in health, but firstly figure out what it is that you would like from a mentor that could support you, and then perhaps seek one. And we've been supporting them along that way to find someone, if they didn't feel they had any contacts, to find someone that could be a mentor. And that's been really important. We involved them in the film piece, and I must say, there was no trouble finding the nurses that put up their hand to be part of that film piece, even though they were nervous, and it was a lot of fun. They had a lot of fun, and as I said, they didn't hesitate. They really wanted to promote their role and tell everyone what they did and become visible, I suppose. So that was the film piece. I'll just go on. So there's just a couple of bits of feedback, not all of it, from our leadership training that we held. And I really liked the first one. So that although someone had attended lots of leadership training, they really found this one practical. And I think it was the sharing of the group that really made it practical. And the members were asked to bring along personal experiences, and the group helped work out where leadership, how you might grow confidence for that situation. So it was really practical. We've also had feedback around what the panel has meant to them. I haven't got a slide on that one, but obviously the networking, the confidence, the building of leadership skills, We learn a lot about speaking with intent, or communicating with intent, to really get the message across that you're wanting to portray. Improve stakeholder relationships with us as a Medicare local, RDNS, other stakeholders, the visibility of practice nurses, primary healthcare nurses, and really increased confidence kept coming through, and just that support of others working in the same sector. So we really see this as an opportunity just for two-way support, as I said. We support them and we love their support to us. We offered some limited scholarships for these nurses that have been giving us a lot of their time, and for them to do some continuing professional development, and there was an application process around that, and that's still currently happening. So they've been taking that opportunity up, which has been great. And with the AMLA opportunity for nurses to do facilitation training and be involved in the practice nurse, the nursing and general practice workshops, one of our members has done that training and is currently involved in that education. So just making sure they see these opportunities and take them if they wish to take them. Communication tools, well, at this present time we use obviously email as our main, group email as our main communication form with this group, but we have researched and had a discussion around what other platforms could we use for this group: Facebook, LinkedIn and web forums. So that's still in the background at the moment. And just, I suppose, moving forward, innovative ways to connect with a wider group of primary healthcare nurses. We really want to reach, and Cathy's touched on some of the type of other primary healthcare nursing that we have reached. I was lucky enough to be asked to come along and speak to the School Health Professionals Association of SA, so a group of school nurses. And they have really welcomed linking in with us, and it's been, I know I've learnt a lot from them and the role of the school nurse and what that looks like in primary healthcare and where we might have opportunities with that group of nurses. So that's just one example of another group we're working with. We've touched on the GP training and the student nurses. Other opportunities through projects that we're connecting with community nurses that are doing aged care projects. It's just how are we finding these nurses, really? The multicultural organisations, we've had a lot of contact with child and family youth, health nurses, and they've been attending some of our CPD, which has been great. We've had the networking opportunities and events that really are about networking, such as the International Nurses Day celebration, and we had just an end-of-year networking opportunity the end of 2013 and really had a positive attendance to that. And other ways, such as our website newsletter and our distribution list, and always maintaining a good database, I suppose. Some more pictures we like showing who the people are that we are talking about. So I want to say thank you, but I want to say thank you to this group of nurses, an amazing group, and I'm really honoured to be able to stand up here and speak about the work we're doing with them. So it's a thank you to them. And thank you to the support of management at the Medicare Local, at the Central Adelaide Hills Medicare Local. If it wasn't for people like Cathy and our CEO and our chair of the board that really do support this work, this really close work we're doing with primary healthcare nurses, I couldn't do what I do with them either, and we wouldn't have these type of initiatives, and they get right behind it, and really it's fantastic. I think I've got to the end. So any questions? Yes. Yeah, I suppose we did in a way, because that's how we spread the word, yeah. Yes. Yeah, well, thank you. We're relying on our panel to help us with that as well. But yes, the fact that I've only just recently met with this group of school nurses, we hope that someone might put up their hand to come forward and participate in our panel as well. So yes, I think just using the networks you've got to increase the networks and really contact people. I know that we have a wide diversity of nurses on, such as our email distribution for our newsletter, so they're getting information that way, I suppose, and they really come to us once the words reach them, I suppose.
And just to also add to that, we had a couple of initiatives around encouraging people to bring someone along. International Nurses Day was one of those examples. Bring along some others that you might be working with, even if they're in sort of a different sector. And we did. The other thing did happen in South Australia was that there was a bit of a mix of that level of support. So what happened was people from way across town were putting their hands up and saying, well, we need some support too. So we said, that's fine, just come along. We did, for the mentor panel, really focus on getting people from our patch, but around education, around other opportunities, we were sort of wanting to talk to whoever would talk to us as well. Yeah, so. And I also wanted to add a thanks to the wonderful people who've been supporting us at AMLA as well. Thank you, Lynn, and your team. We will miss you a lot. And it has been, those sorts of opportunities have been other vehicles for us to get people together around education and other things. So thank you, and all the best. Thank you.